Hi, this is Dr. Donald Pelto. Today I want to talk a little bit about something called a Tailor's Bunion. What a Tailor's Bunion is, it differentiates from a regular bunion because you can see a regular bunion is found on the big toe joint where there's an increased space between the first and the second metatarsals. So there's an increased space, there's a big bump out there, and we call it a Tailor's bunion because it's on the outside. So it's between the fourth and the fifth metatarsal where there's an increased space there. Sometimes there can be an enlargement of the bone, and sometimes there can be a little sac of fluid in there, and this is called a Tailor's bunion, or also called a bunionette. The reason they call it a Tailor's bunion is when tailors used to work, they used to have their legs crossed all day as they sewed, and they thought that possibly that constant irritation could cause this type of a deformity. This many times is painful for people, and it can be painful in shoes, it can be painful barefoot, it can be painful from the callus. So really, what are the causes of a Tailor's bunion? Most of these are caused due to heredity. So you may get it from your mother, from your father, this big bump out here that's painful. It can also be caused by a mechanical instability in your foot where the space increases between these two bones, and as you're walking, you're putting a lot more pressure on the outside. You may have this problem, this Tailor's bunion, and it may not irritate or bother you. A lot of people have these, and then when they wear a certain type of a shoe, it becomes irritable, it becomes inflamed, it becomes painful, or sometimes there's even a callus on the bottom that becomes painful. And some of the easiest treatments are just to trim off that callus. For many people, that can help make it feel better, but it usually doesn't make this bony deformity. It's hard to make a bone that's deformed to go away with just trimming a callus or trying pads. So to determine you have a bunion or a Tailor's bunion, you would evaluate an x-ray. You can look at the foot, and then you look at the x-ray to see if there is an enlargement between these two bones. This is once again the fourth and fifth metatarsal angle. Where this bone should be, it should be right here. Now, beyond being over to the side, you can also see that it's shortened. So if you draw a line right here and you draw a line right here, there's a big gap between those bones. So as you're walking, this area gets a brunt of the pressure and the punishment, and then it tends to get inflamed in this area. Once again, you can see this is an example of a foot with a bunion and a Tailor's bunion. This one doesn't have a bunion. It only has a Tailor's bunion there. How can we help it? Initially, to get down some of the pain, as I mentioned before, if there's a callus, you can trim the callus in the bottom. And if there's a sac of fluid on the side that's kind of swollen, it's called a bursa, and that can be reduced using some cortisone either into the joint or into this little sac of fluid. That may cause some of the swelling and pain to reduce, but it may come back, especially if that bursa has been there for a while. Sometimes you have to remove that bursa with surgery. So we do a cortisone injection that can help reduce the inflammation in the area. And then to reduce the irritation, there are many different treatments. Normally when someone comes into the office, I recommend a little gel pad that can be used on the area. Once again, this just protects it from rubbing and irritation. You may do that in conjunction with the cortisone injection. And then along with that, I recommend either a sandal or some type of a shoe. You can see the difference between a tapered shoe, how this would rub a lot more, and a kind of a minimalist or a wide-toed shoe that's going to irritate a lot less on there. So shoes are a big culprit. It's very easy to take the sock liner out and step on it, and you can see if the shoe is too narrow. Also, to reduce the irritation, something that is many times not done that works really, really well. Here's a little secret. You take the sock liner out of your shoe and you cut out the region under the fifth metatarsal head, kind of right here, and you take that extra piece that you removed and you tape it behind that. You tape it proximal. And so what that does is it adds padding before it, and it takes pressure off that head of the bone, and it gives you more space. Another way of doing it is with one of these pads called a reverse dancer's pad. This is a pad that goes in the front of the foot, and you can see this one is under the sesamoid, but you can just as easily flip it around and put it underneath the Tailor's bunion right here. And so as you're walking, it would put pressure here and take the pressure off here with a pad. You could also do the same thing with this by cutting this out and moving this back. If that really helps you, then that can actually be incorporated into an orthotic. So once again, doing an orthotic with a cutout in that region, and you can even add a metatarsal pad right here, that can take the pressure off of the fifth metatarsal for you. So that's more of a non-surgical approach to treating it. If surgery is needed, There are different types of surgeries, but the whole goal is to take a bump and get rid of the bump. And you have to realign the bone. So you have to do a bone cut, shift the bone over, and then put some screws in there. Other times you can cut it right here and just shift it over and not use any fixation. But to get a really good looking foot, it's easier to fixate the bone. That's one example right here. And here's another example before and after. This patient had that bone shifted over, and there may have been a little sac of fluid in there that was removed as well.